Good evening and welcome to our presentation tonight on lasers, light, and youthful skin. I am Dr. Barry LaBine, and I will be giving this presentation tonight. I am a board-certified dermatologist, and I've been in practice for almost 25 years. I've been using lasers for the 25 years in practice, as well as during my residency training. So I have a long history of using lasers and enjoy lasers. It's one of the things I greatly enjoy in my practice. Disclosure, I am a dermatologist, so my perspective is from a dermatology perspective, and I'm also an owner and the medical director of Refined Dermatique Aesthetic Center. Our goals and our agenda tonight are a few things. The first is to discuss the basics of aging skin and sun damage, because I think before we talk about lasers, we need to have some background on skin, how we age, how sun affects the aging. We'll then talk about lasers, how they interact with skin. And then specifically, I'll talk about a few lasers that we use here at the Aesthetic Center. At the end, there will be time for questions. So we'll take those at the end. I'm not going to answer questions during the talk, but we'll do it at the end. Some of you have already emailed questions in, and we tried to introduce those right during the discussion to answer some of those questions for you. So what do we treat with lasers? There's a whole plethora of things that we can use lasers for. We can use it for photo rejuvenation. We can use it to improve texture of the skin. We can look at different pigmentary disorders we can treat. We can use it for acne scars as well as wrinkles. We can use it for age prevention, and that's kind of a new thought in the last several years. We can use it for blood vessels. We can help improve radiance of the skin. We can help with hair reduction as well as brown spots. So there's many different avenues that we can use lasers and light sources for as we interact with the skin. So first, we're going to talk a little bit about Skin 101. We're going to talk about some of the basic anatomy of the skin, how our skin and structures change as we age, and how sun ages our skin. This is important to understand before you start looking at how lasers interact with the skin. So this is a schematic of young skin on the left and aged skin on the right. So I'd like to go through that a little bit, because I think it makes sense then when you're thinking about some of the abnormalities that you're seeing on your skin and how laser can affect and improve those areas. So when you're looking at younger skin, you have a nice thick epidermis, you have a nice thick dermis, and then you have the fat or the hypodermis down here. When you look at the epidermis, you have a nice layer here. We call these reedy ridges. They're nice and undulated. They provide a nice support or connection between the epidermis and the dermis. Down in the dermis, we have these nice lattice structures of collagen and elastic tissue to provide support to the blood vessels, to adnexal structures, which are like the sweat ducts, part of the hair shafts. So we have a nice supportive structure that's there. And you can see this nice thickness here. So you're not seeing a lot of the blood vessels, et cetera, that you can normally see through the skin. So this is young skin. With normal aging, just normal aging, changes happen. And a big one is that the epidermis, the outer layer of skin, will thin, or we call that atrophy. And that's a big deal, because now that outer layer of the skin is very thin, so we can see things through it much easier. In the dermis, we have a breakdown of collagen and elastic tissue, and you also start losing some of the dermis, so that becomes atrophied as well. And then you have sometimes loss of fat in areas. When you have the epidermal atrophy or the thinning up here, we often will lose these nice connections that we have between the epidermis and dermis, this nice undulation or this support that we have here. And when you start having the thin epidermis and you lose this support around blood vessels, you can see the blood vessels through the skin much easier, and we start getting pigment because of years of aging, just environmental changes. We start seeing those through the skin much easier as well. So those things normally occur as we age. If you look at this a little bit differently as some histology or pathology pictures here in schematics, this would be young skin. And so when you look at it underneath the microscope, there's plentiful collagen and elastic tissue. It's very firm and robust. There's a nice connective tissue or support. And if you look at the schematic, we have really nice collagen elastic tissue providing support at that junction. And because of this, we really don't see lines and furrows. We have a really nice supportive network. As we normally age over decades, we start losing some of that collagen elastic tissue, and that's normal aging. So when we lose this collagen and elastic tissue, we don't have that support along that junction, and we don't have the support deep. So we start seeing some of the lines and furrows and wrinkles that appear. Now, if you take the normal aging and you add a lot of sun damage to that, you get much more marked loss of collagen elastic tissue. And as you can see in the schematic, that really makes the skin look different because now you have even less support. The skin will thin out and you start seeing more of the pigmentary changes, the vessels, as well as the deeper furrows that occur. And so extrinsic things like photoaging can really accelerate the aging process in the skin. Also, when you're looking at patients or yourself as you're aging, there are many other things that take place as well as in the skin. So if you look at this person in their 30s, they have what you would call a youthful face. They have nice arched eyebrows. You don't see many wrinkles across the forehead. You don't see many furrows through this area. You see nice, tight skin. They have nice collagen, elastic tissue. They have fullness through the cheeks. If you look at this area here, it looks like an inverted triangle, and that's a youthful appearance. They have nice full lips. This area here, they have a nice ratio with the lips and the border here. And as if you look from the side views, you'll see that they have a nice line here. They have nice support from this upper area, and you see a nice tight line or jowl, which provides support for the neck, and that's a youthful appearance. As we age over time, we start noticing that we start losing some of the fat and some of the bone along the forehead, the cheek areas. You start seeing some of these lines that develop because of that. We start losing collagen and elastic tissue. So what happens over time, you start losing some of the thickness of the lip. This area becomes wider. And as you look on the sides, we've lost this 3D structure. So you don't have this nice sharp jawline. And as a subsequent loss of this volume, you start getting some of this redundancy of skin in this area, and you can start seeing jowls that develop. And this becomes more exaggerated as we age, when you get the deeper furrows from the muscular contraction, our skin is thinner, and you have more accentuated loss of bone and fat in these areas. So that's all normal aging in patients. I do want to digress a little bit and talk a little bit about pigmentary change, because that's something we get asked a lot about. As we get older, especially with sun damage, we start developing brown spots on our face, or these pigmentary changes. We don't have the radiance. In a normal skin model here, you can see we have these melanocytes. Oh, excuse me. And melanocytes make pigment, the melanin. And this melanin extends up into the higher epidermis, and we normally shed it off. But over time, as we age when our skin thins, and with sun exposure, we stimulate these melanocytes, and sometimes hormonal changes in females, we make a lot more pigment. So as we age, we start getting these brown spots that develop in the skin. And the difficulty sometimes in treating this is where the pigment is. If it's really superficial, sometimes it's really easy to take care of. Sometimes just with some bleaching creams or things like Retin-A over time will help. But as this pigment gets dispersed to many different layers in the epidermis, or sometimes in the condition we call melasma, where we get some of the pigment deep, it's very hard sometimes to treat this pigment. And also, the melanocytes, their job is to make pigment. So even if we treat some of this, over time, these melanocytes are trying to make new pigment. So you end up having to do maintenance treatments to make sure that you're addressing these pigmentary disorders. It's kind of like asthma as a chronic condition. You never cure it, but you control it. And the same thing with some of these pigmentary disorders. And things like sunlight and hormone changes can really add fuel to these melanocytes to make more pigment. Sun can have great effects on the skin. It creates significant changes to the skin. And there's really two wavelengths that make a big difference in our skin. And that's UVA wavelength, which is a longer wavelength. It'll penetrate down into the dermis, and it really does break down collagen and elastic tissue over time. And UVB, which is the one that we associate with burning, is a shorter wavelength, and it'll affect in the epidermis, but will create a lot of problems with pigment. Back when sunscreens first came out, no attention was really paid to the UVA. It was a UVB blocker. So for years when we wore sunscreens, we weren't doing anything to block the UVA. And we now know that this creates problems with skin cancers as well. And so I think our first sunscreens that came out decades ago weren't helpful at all. So if you look at this diagram, with those two rays, we are definitely creating problems, not only in the epidermis, but down in the dermis. And over time, you're going to have uneven pigment. So you're going to have more browns and reds. The texture is going to change. It's going to create fine lines and wrinkles. And I'm not even talking anything about skin cancers here, but definitely they increase your risk for skin cancers significantly. So I think one thing that I always mention to my patients is your skin has memory. It doesn't forget. So if you had a lot of sun damage as a kid, eventually it's going to catch up with you. It might take decades, but it will. But it's never too late to start protecting your skin. And I'm going to get on my soapbox just for a second, because as a dermatologist, because I think photoprotection is the most important thing you can do for your skin, period. So if you forget everything else I say tonight, I think that's the thing that you need to remember. And I always tell my patients a positive side effect of being careful now is you'll look younger when you're older. And I tell this to my skin cancer patients all the time, and I truly believe it. And I think photoprotection isn't just sunscreen. I think it's trying to wear a hat. It's wearing UV protectant sunglasses. I love UV clothing, and watching things like the peak sun hours between 10 and 2. All of those, if they become a habit, will be your friend long term. I also think as a dermatologist that good medical grade products make a difference. I think they can enhance and maintain in-office procedures. And I think if you're going to spend the money having cosmetic things done to look better, that you should be using good products because you want to protect your investment. And I think they do make a difference long term. And there are many good products that are out there now. So that was Skin Anatomy 101. So basically, as we age, our skin's going to thin out. We're going to have changes in the collagen and elastic tissue. Pigmentary changes are going to show. We're going to see blood vessels. As we get older, we're going to lose some fat and some bone in the face, so we're going to lose a little bit of that 3D structure. But there are things we can do about it. So number one, we talked about photoprotection. 2, good products. But light sources and lasers also can play a role and make a nice difference for patients. So we're going to spend a little time talking about lasers and a little bit of basics. So laser stands for light amplification by stimulated emission of radiation. So that's where laser comes from. It's a specific wavelength of light that transmits light energy into the skin. So the wavelength needs to get in to do its action. And really, with lasers, there's three main targets. Number one is hemoglobin, which is the red blood cells in our vessels. Number two is water, which we have plenty of water in our cells. And three is melanin, which is pigment. And if you look at this graph, there is increased absorption with different wavelengths. So they've figured this out years ago, which wavelengths of light affect which targets more effectively. And this has all been studied and developed over the years. So we now have a good understanding of which lasers or wavelengths we should be using for what problems. And that is part of the process. Part of it also is with lasers is you have to understand not only the wavelength of light, but you need to know different scenarios that make a difference, such as what skin type they are, what is the pulse width, what is the temperature of the skin. You need to know all these and take those into effect to optimize the result, but also to minimize side effects. And this is just a schematic showing many different lasers have different wavelengths of light. And this one just kind of shows where they hit between the epidermis, the dermis, and the fat. And so there's many different lasers out there. But again, that's only one parameter is the wavelength of light. There's other things that can be adjusted. So you need to know those basics when you're doing laser, and you need to know skin types as well, because certain wavelengths of light you don't want to use on certain types of skin or you can have problems. So what are the benefits of lasers? I think they're safe if they're used appropriately. And being used appropriately means understanding the physics, understanding skin types, understanding the problems that you can have with lasers. I think they're very effective. The lasers have really progressed over the last 25 years. They're amazing, some of them. One big advantage for several of these lasers that have been developed in the last several years, there's a little downtime. And also you can highly customize the treatments because everybody's different. Everybody has different skin types. Everybody has different needs, wants. Some people are good healers, some aren't. Some don't have time for downtime, some do. So all those things need to be customized. But the one thing I want to say is that lasers aren't a toy. You can damage people if they're not used appropriately. And expertise matters. So if you're going to have a laser procedure, you need to make sure that you go to somebody that has experience and knows what to do if there is a problem. They're not a toy. I like to look at things simply if I can. And so I'm going to try and break them down a little bit into three categories. The first would be non-ablative, or I would call this no downtime or very little downtime. And with non-ablative lasers, what you're doing is you're having the wavelength penetrate through the epidermis without disrupting it. So there's no sores, there's no open areas. The wavelength is going down into the dermis. It's affecting the target that you're aiming it at and doing its job. And there's no downtime with it. Ablative lasers are a little bit different in that you are disrupting the epidermis. You're vaporizing it. You can customize it and adjust the depth so you may have very little downtime, but you can also be much more aggressive and you will have more downtime. And then there's a new generation of hybrid lasers that combines more than one laser together. With these, you'll have less disruption to the epidermis, but you will have some, and you can also tune these and you can have variable downtime with these. So you can customize treatments based on the laser and what the desired effects are. In our practice here, we have several different types of lasers. Non-ablative lasers, we have something called BBL. We also have another laser called Aerolase, and we're going to be talking about these a little bit. We have ablative lasers, profractional. We also have a microlaser peel. These are some downtime lasers, and then we have a hybrid laser called a halo that we use. BBL is a name for a light source. So technically, it's a little bit different than a laser. It's a light source, meaning that it's not one wavelength, it's a spectrum of wavelengths. So we can customize it with filters to go after the target that we desire. And we've been doing BBLs for approximately almost 11 years, I guess it is. And it's probably one of the favorite things I do in practice. It works. There's no downtime. And it has some good data behind it. And we'll show you in a second here. If I can get the technology to work here. And I may need my technician to come and help me here. One second, sorry about that. I'm having trouble getting the video up here.
BBL optimally delivers infrared and visible light, penetrating through the epidermis and dermis, stimulating changes at the molecular level and visible changes in the dermis. The gene expression of older, damaged skin cells changes and will more closely resemble the genes expressed in younger skin cells. These genes are involved with aging and longevity, and many are associated with increased lifespan. The cells are reinvigorated, and over time, the skin looks much younger. There are visible improvements in skin firmness, elasticity, and pigmentation. With regular BBL treatments, the skin is clear, smooth, and more youthful.
So Dr. Patrick Bitter is a dermatologist in California, and he's been one of the big driving pioneers with BBL therapy. And he was involved with a gene study that schematic just showed that people that were having BBLs done over a period of time, many years, their skin just tended to look better. They didn't seem to age as much. And so he got together with a couple of geneticists, and they actually did a gene study at Stanford. And they showed that it actually reverses some of the gene expression in the skin back to younger looking skin. Now, this is a landmark. This is the first time that's ever been shown with a laser light source that actually helps down to the gene level in the skin. And I think that's exciting. I think that over time, I think lasers are going to be used in other ways for this to slow down the aging process. And I think it's remarkable, and I think that it's exciting. And like I said, we've been doing BBL therapy for over a decade, and I couldn't explain why some of these patients just seem to look good long term with basically minimal products and sun protection and just BBLs. But now I think we know why, because it is an effect that goes all the way down to the gene level. And I'm a big proponent of BBL therapy long term. Now, these pictures here are actually of Dr. Bitter himself, 12 years apart. And the one on the left is him when they started, and I believe it was actually from a Polaroid because it was so long ago. And this is 12 years later, and I don't think anybody would argue that his skin just actually looks better. And I met him, and he talked about basically this is just with BBLs, minimal products, and good sun protection, which I think is pretty remarkable. Now, here's a couple cases here just from our center here. This is someone that has significant photo damage. She has lots of browns, lots of reds, and really has had a lot of sun over the years. And so this is just with 4 BBLs, a couple weeks apart. This is our corrective series. And you can see she's had pretty significant improvement. Is it perfect? No. Can we do better? Yep. With more treatments, we definitely could. We could also add some good products in there, or we could do some ablative lasers, but she's happy with this. And she's continuing on with just 2 a year. And I think over time, we're going to even get this markedly better for her. And she was quite happy. We use it a lot for rosacea as well. Rosacea is a condition where people get redness, flushing, a lot of blood vessels. This is a young gentleman that was really bothered by his rosacea. He had significant rosacea and flushing. And I had seen him in the clinic. We had tried about everything medicine-wise. So I talked to him a little bit about the BBL therapy, and he wanted to do it because it bothered him so much. So this was him at baseline, and this is actually fairly good for him because if he flushes, his whole face would be red. This is after 4 treatments, and he was starting to notice significant improvement. And you can see the improvement of the vessels. And so he continued. And he did, I believe it was 3 or 4 more over the next year. And you can see he's still getting continued improvement. And again, you have to remember, this is just non-ablative laser. We're not disrupting the epidermis. And there's no downtime with these lasers. This is a lady, another one of our clients that has significant photo damage. As you can see, she has a lot of these pigmentary changes, or what we call lentigos. This is all from sun. And this is after 4 treatments. And she continues as well, just 2 treatments a year. She is somebody that has pigment-producing cells that are really active. So in the summer, if she forgets to wear sunscreen or reapply it, these browns want to come back. So during the summertime, sometimes we'll put her on a little bit of bleaching cream as well to maintain her results. There's another patient with very severe photo damage. You can see some of the browns. She has reds, really not much radiance of her skin. As you can see, she's had, I think in this one, she's had 4 treatments, and this is a few years later, and she's doing 2 treatments a year. It not only helps with the browns, reds, it helps with the radiance of the skin, but you can see in some of these her pores even look better. Now, we're not addressing other things. We talked about the aging. You know, she's got some volume loss in her cheeks that gives you some of these wrinkles here. There are other things that we could do for that, but if you look just at her skin looks a lot better. So I'm a big fan of BBLs. We've been doing for over a decade. I actually am done myself because I'm a firm believer in them. We often will do the face, neck, chest. We can do the hands, and occasionally we'll do other body areas as well. The next laser I'm going to talk about is an Aerolase laser, and we've had this for approximately 2 years now. This is another non-ablative laser. It helps with reds, browns, but also photo rejuvenation. We can use it for hair removal, and we use it for acne, and it's a no downtime laser. I got another video here for you. This was shown on national TV this last year. We've had it for 2 years, but I think this was just this past 6 months that they showed this on the Kathy Lee
Sagging skin,
show.
sunspots, acne, and more. Sometimes our skin can leave us feeling a little less confident than we would like.
So when my dermatologist, Dr. Patricia Wexler, told me about the non-invasive laser procedure called Aerolase Neo, I had to check it out. That's my job. But Aerolase Neo has a new technology with a shorter laser pulse, meaning less pain. So let's check it out. When my friend and dermatologist, Dr. Patricia Wexler, told me about the laser technology called Aerolase Neo, I wanted to learn more. So here I am again.
Here you are again.
Gretchen, you always fill me in on the latest and the greatest thing.
We have the newest, this is the only laser with this technology.
And what's it called?
It's called the Aerolase Neo.
With 30 FDA-approved treatments from acne to rosacea, this procedure is all about less pain for a broad range of dermatological applications. Both Dr. Wexler and I decided I was a good candidate for skin rejuvenation and tightening with the Aerolase Neo.
What's new is it has a short pulse, and it goes right to the target. Wow. And the target is redness, which is for rosacea and inflammation, pigmentation, like melasma and sun damage, and water, which is where we stimulate collagen and elastic tissue for rejuvenation. So we can give you this laser treatment with zero pain.
That's the best news.
No numbing. You can start the laser treatment the minute you come in. Right. No irritation of nerve endings. So for young people, it's the treatment of choice for acne now.
You need several treatments, I understand.
You need several treatments of this.
About a month between?
Usually 3 to 4 weeks.
And immediate results?
Some of the results you'll see within a week or two. Okay. You'll start seeing the results. Right. For acne, you see them weekly.
But the biggest benefit is less pain.
Pain is a big issue. Yeah. People really don't want to pay for pain. I'm anxious for you to get started.
Here we go. Dr. Wexler's husband, Dr. Eugene Wexler, joined us to perform the actual laser procedure. Since there is no topical cream needed for numbing, it was time to get straight to business. You feel a little heat, and it feels like a teeny little prick thing, but not that hurts at all. No, it's more like a tingle. But a little moral support from a friend never hurts. After 20 minutes, the procedure was done, and no pain. Ta-da! I know. Thank you, Mama, for holding my hand. Yeah, that really was. I mean, it's nothing but
it is nothing.
Last step, LED lights to help lessen any redness from the laser. Now, after 4 Aerolase Neo procedures over 5 months, the after is all about skin rejuvenation.
Wow.
Yeah. Possible side effects of lasers include scarring, burning, hyperpigmentation. Didn't have any of that. Cost of Aerolase Neo varies depending on what exactly is being done and regionally, but it usually ranges between $425 to $1,500 a treatment.
Dr. Wexler is here. Dr. Francesca Fusco are here to show us the procedure. We got a patient here, and you
Jennifer
said it didn't.
Dale.
You said it didn't hurt. Can you
zero pain?
Zero pain. Will you just zap me just on my arm, just so I can?
Come on over a little closer. Ready? How'd that feel?
It was like a blow dryer.
Want to try another one?
I felt absolutely nothing.
Yeah, like that's a miracle of it. Yep.
This is a patient that underwent the Aerolase 4 treatments. As you can see, it definitely helped her radiance of her skin, her reds and browns, and helped some of the fine wrinkles. I can tell you the key with that laser is the short pulse width. It's revolutionary, and that's why it doesn't hurt. And I've been quite pleased with it. So we do this most frequently for hair removal. We use it for photo rejuvenation and vessels and acne. And the other nice thing about this laser is we can use it in really dark skin types and not have to worry about it. Some of the lasers you have to be very careful in darker complected individuals, but this one, this laser is colorblind. It doesn't matter. So it's kind of nice. One of the things that's been really exciting about has been acne. And that was one of the main reasons when I first got this laser was I was looking for an alternative to using antibiotic pills as much as I could. So I really did my research, and I talked to several people across the country that were using this, and I'm always skeptical, but I can tell you that it's been an awesome addition to our acne clinic. This is a patient that had 5 treatments. I believe they're 2 weeks apart. She is on a little bit of topical medicines, and she's had I would call this a home run. This is somebody that would end up being on high-dose antibiotics or Accutane, and she's done great. And with somebody like this, after the 5 treatments, we basically keep them on topicals. If they start having worsening, they'll come in and get a treatment as a touch-up. I also think what's really exciting is it's helped, the treatments have helped with their acne scars as well. Because usually when you have inflammatory acne like this, they start getting a lot of pigmentary changes as well as scarring. And because it helps with photo rejuvenation as well, I think we're helping the acne scars at the same time as we're treating the acne. So it's pretty exciting as well. So those are our non-ablative lasers, no downtime. We also have what I mentioned before, some ablative lasers, and one of them is a microlaser peel, and this is ablative. So this is something you would come in, we put a little bit of numbing cream on you, and we can tune it. Now we can do a really superficial microlaser peel, just a few microns. And so basically it's a freshen up type peel where you just look kind of a little dry and maybe a little pink for a few days, or we can do a much more aggressive, depending on the level of your wrinkles or acne scars. It also helps with pigment, texture. This one, we don't want you out in the sun afterwards. And there is a little bit of post wound care as well. We also have a profractional laser. Now this is ablative as well, but it's a computerized scanner. And so instead of vaporizing all the skin, we're basically drilling little holes down into the skin. So instead of treating all of the skin, you're only treating a small amount of the skin. And so you have less downtime. It creates these little channels that go down the skin, and we can adjust how deep we want to go. And it really depends on what we're treating. If we're treating acne scars or superficial or deep wrinkles, we can totally customize and change the parameters. I like to use a professional a lot for post-operative scars. It works very well. The halo laser is a hybrid laser, and it's really one of the newer lasers. It's really 2 lasers in one. We have a non-ablative laser, so we can go down through the epidermis without disrupting it, combined with ablative laser. And it appears that the combination of the two together sometimes will really diminish or decrease the amount of downtime versus just a total ablative laser. This laser to me is really advanced. There are several things about it. One is this handpiece is extremely smart. With the handpiece, what we do is we treat the face in different zones, and the handpiece is used to mark out basically the area, and you calculate the total area being treated. We put in the parameters of the depth and density that we want, and the computer figures out how much energy needs to go into that zone. And it has a temperature sensor on the handpiece, and so we can monitor the temperature as it's putting in this energy. If your temperature of your skin starts heating up too much, it slows down how quickly it's putting the energy into the skin, so you don't have problems, so it's safer. It's really revolutionary, especially being someone that started back with a 3mm spot size, painting a face, which would take 2 hours. This is really revolutionary, and it's really it changes the way that we do things. We use this mainly for photo rejuvenation and acne scars. And there is a few days of downtime with this, and there is a little bit of wound care as well. Now this patient here has had, I gotta look at my notes here. This patient has had one halo 3.5 years ago, and she had some skin pen, and now she's just doing some BBLs. And if you look at her skin, just the radiance and the texture, the tone, some of the pores. She's markedly better. Now she's still aging. And is it perfect? No. We could do other things to help with this. We could do aggressive skin pen through here. We could put some filler up in this area to help with some of these rhytids. So what I'm trying to tell you is that there isn't just one wand and it gets rid of every single wrinkle. But many times, just by improving the appearance of the skin, people look younger. The other stuff is more cherry on top of the cake. This is another person, and this is over many years, where she's had a BBL series. She had one halo and she had some skin pen. And so this is her, and this is, I think it was several years later. As you look at her skin, she's got very nice texture and radiance. She's got real nice smoothness of the skin, and you can tell it helped some of the wrinkles as well on this patient. So she believes in maintenance as well, and she's doing a few BBLs per year. So that's kind of covering some of the lasers that we do here. What do you expect when you come in? Because people hear the word laser and they get really freaked out, and it's probably from the Austin Powers movie. But really, many of the lasers, there's especially the non-ablative lasers, there's not much discomfort. We do have, when we do BBL therapy, we have a little device called a Zimmer cooler, which helps blow cool air. But when you come in, you've already had your consult. We're not going to see you start lasering on you, because there's some behind the scenes consultation that needs to take place. We need to know your history. We need to know your sun exposure. We need to know your other health problems and medicines, those kind of things. And then what your desires, expectations, and what your schedule looks like. So once we've done all that and looked at your photos, then we can kind of come up together with what would be the best treatment for you. So once we've decided that, and you're coming and you're going to be having your laser that day, you come in. We usually put a headband on you to pull your hair back. We cleanse your face. If you're going to be having an ablative laser, we apply a topical numbing cream, and that'll be on for anywhere from 60 to 90 minutes. We'll discuss with you what you need to be doing afterwards. One of the most important things is we use eye protection. The patient uses eye protection, and everybody in the room uses eye protection, period. There's no exceptions, because that is a high-risk area if your eyes aren't protected. We also have a sign on the outside of the door: nobody enters that room while we're lasering, period. Those are things that I am extremely strict about, and we have strict protocols here regarding the lasers. As I said before, they're not a toy. It's a tool, and we need to use it appropriately. If we're using BBLs, we apply ultrasound gel to your face during the procedure, and then we begin the treatment. Most of these treatments take approximately 30 minutes. Once we start, when we're done, we cleanse your face. If we need to apply any product, we do, but everybody gets sunscreen before we leave, period, because we believe that you need that as you leave, and we do that year-round. Oftentimes, we're going to do a corrective series if we're doing BBL, Aerolase, etc., and so then we schedule your next appointment, and we see you for your next appointment. Just a couple quick points here, though. Combination therapies are very helpful. You can kind of think of it as CrossFit of the skin. As I was pointing out in a few of those pictures, the BBLs will help, but sometimes you need a more aggressive laser. Sometimes we can use some filler or some Botox. I think the good products help. So oftentimes it's a combination that you need to really get that look that you're wanting. And so we have that capability. We have multiple bullets in our gun. The other point I do want to make is maintenance. You don't go to the dentist once for your entire life. Same thing with laser. Many times, if you're going to have something like a BBL and you have the corrective series, you need maintenance. You're living, you're aging, you're exposed to environmental things such as sun and other things. And so maintenance is important, especially once you get to that level that you're happy. You need to make sure, and it doesn't have to be extensive, but it should be a simple regimen, and we can lay that out for you. Just in the last few months, we developed something called VIB membership that will help with that maintenance, make it a lot simpler for patients. And my staff can talk to you about that program. So in summary, lasers are effective and versatile, and they need to be used appropriately. You need to have somebody that understands lasers and understands side effects that you can have. It's safe if you're using the right laser for the right person under the right parameters, but you need to understand those parameters. And we want to address some of the underlying causes, not just the symptoms. So I'm a firm believer, and my staff understands that everybody that's in having procedures, they get lectured on sun protection, first and foremost. They also get lectured on using good products, because we want you to have good results, long-term results, and be happy. And that's the end of my talk. And I'll wait and see if we have some more questions and roll in. I don't see any. So I've got one question here, and the question is, when do you use BBL versus Aerolase? And that's a very good question. There's a couple things. First of all, if you have Asian or Afro-American skin, very darkly complected, I would probably tend to use the Aerolase because there's no issues. With BBLs, we can use them in those patients, but we have to be very careful on the parameters. The second thing is, if you have a little bit deeper wrinkles or rhytids, we might start with the Aerolase, just with the photo rejuvenation instead of the BBL. Sometimes we'll do both, to be frankly honest with you. So I think they're both great treatments. Has to do with the level of wrinkles that you have, as well as the pigmentary changes. The next, I just got a note that says, if you have question, submit it in the box on the right on your screen, and I can get them that way. The next question was, how much does laser cost? Well, it really depends on which laser and how many treatments. Just as a general rule of thumb, when we're doing series, corrective series, they're sold in a package. And on average, the non-ablative lasers, I think, are right around the $300 range or a little bit less. So if you're doing a series of 4 BBLs, for example, it's probably about $1,100 for four treatments. I did notice on that thing with Kathy Lee Gifford, the price range they gave. Well, I can tell you this, we have Midwest pricing. We don't have East Coast pricing, because we're a lot cheaper than they are. There's another question here. Does the brand of the laser matter? There are a lot of good lasers out there, and I'm not going to say just brand makes a difference. I think wavelength and pulse duration and cooling devices, all those kind of things make a difference. So you could have the best laser in the world, but if you have somebody that doesn't know how to operate it correctly, you could have problems. So the lasers that we have in our clinic, I spent a lot of time researching, and I spent a lot of time reading their articles, and I spent a lot of time talking to physicians across the country before we purchased them. And I've been very happy with our lasers, and I like our Sciton platform laser that we use for the ablative, because it's totally tunable. I can adjust all the parameters as far as the depth and the density, and so I have good control over the treatments rather than just one standard depth and density. So I would say that some of the companies matter, because some companies are better than others, but you really have to look at the wavelength and the other parameters that are with it. There is a question on melasma, and melasma is a pigmentary change that affects the epidermis, the outer layer skin, as well as the dermis. And melasma is one of the harder things we treat, to be frankly honest with you. I will say it's a chronic condition. It's something we can try and control. I can't cure it. Hormones, sunlight, skin type all play a role. Sometimes it responds to laser, sometimes it doesn't. There are many times we'll use chemical peels, and we'll use skin pen as well as bleaching agents and good products. But melasma is a tough one, I'll be honest with you. And we are very honest with patients when we start, and we want to make sure that they're well aware of that. There's a question: can you have eye damage despite eye protection? If you're using eye protection, you're not going to have eye damage. They need to be put on appropriately. It needs to be covering the orbit, and we don't laser inside the orbital rims, period. There are ways you can do that. We don't do it here. I don't like problems. And so if they're put on appropriately, you should not be having eye problems. There's a question here about chickenpox scars. With some of the chickenpox scars, we can use laser on. Sometimes it'll take a multiple treatments. Sometimes we will use other modalities like skin pen, or sometimes you have to do punch excisions. You really have to look at them and see how many you have, and how many they have and what the depth is, as well as the skin type. But you can improve chickenpox scars with laser. There's a question about what other negative side effects can you have with laser. Well, there's several things. First of all, when you're using a laser, you are creating a thermal injury in the skin. So you need to make sure that you know their skin type, and you need to know what depth you're at. You need to know the pulse duration. So you need to know all those parameters, because if you don't, you can cause scarring. So you need to be very careful, and that needs to be monitored, planned out ahead of time and monitored while you're lasering. The other thing is you don't want people going out in the sun afterwards. For a while, they need to be very careful, because they can get increased pigment change in their skin or hyperpigmentation. So we're big on that. If we're doing big ablative cases, we don't like to do them during the summer. We like to do them in the winter here. If we're doing non-ablative lasers, and we'll do them all summer long, but people have to tell us that they are very careful about sun protection. Other things that are important is if people are prone to cold sores and we're using ablative lasers, we always make sure we use antiviral therapy on those patients around the time that we're doing it. We're also really stress the wound cares on ablative lasers. So yes, if you're not doing things right, you can have side effects. There's a question about difference between CO2 lasers. I don't know exactly what the question is, but CO2 lasers are lasers that are ablative. And when we talked about this earlier, we talked about ablative lasers. I do have a couple of ablative lasers here. I use the Erbium YAG. But again, CO2 laser is a type of ablative laser where you're vaporizing epidermis. And so for most of those lasers, you can adjust the depth and the density. And again, it's ablative. So there is downtime, and you need to be careful with those. Now, there's another question. I'm just looking, is there any chance of causing damage to the eyes if they are covered? We've already covered that. If the eye shields, eye protection are placed on appropriately, that's not an issue. Again, we don't laser inside the orbit at this facility, but everybody has to have proper eye protection, period. There's a question at what frequency are the non-ablative procedures done, i.e. once per month, every 2 weeks, et cetera, for preliminary 4-session treatment package. When we do a corrective series, depends on which laser, we go anywhere from 2 to 4 weeks, generally in between when we do the corrective series. And then many people then, if they do maintenance, depending on how much sun damage they have and what their desired outcomes are, they'll do a maintenance treatment once every 6 months. What does VIB stand for? It's very important beauty. It's a membership program that we have here. And if you talk to my staff about that, they can tune you in for that. I think that was it for the questions. I would like to personally thank you for spending the evening with us. Lasers are a passion of mine. Hopefully, we learned something here tonight. If you have questions or you have things that are bothering you, be happy to contact us. We'd be more than happy to answer your questions. And I want to thank you again for taking time to listen to the webinar tonight. Have a good night.